morning and welcome to ALS 101, presented by my awesome colleagues, the care service managers. So today's objective, we want to offer an understanding of what is ALS and its impact on people living with it and their loved ones. We want to improve an overview on ALS treatment, and we want to share the great work of the ALS Association in making ALS livable until there is a cure. Technical difficulties. So ALS, which is amyotrophic lateral sclerosis, it is a neurodegenerative disease in which a person's brain loses their ability to connections with the muscles. So unfortunately, a person with ALS will lose their ability to walk, talk, eat, and or breathe. I'm not seeing this. So, I'm sorry, I'm having technical difficulty on my screen here. All right, we're gonna improvise. So ALS, which is a diagnosis, who is affected by ALS? It is military veterans are twice as likely to get ALS. ALS is 20% more common in men than in women, and the mean age is 55, but can vary from teens to 90. It also occurs in all races all over the world. So what are the two types of ALS? We have sporadic ALS, which accounts for 90% of ALS cases, and then we have 10% of ALS cases, which is familiar ALS, and that is inherited through a mutated gene. And what are the symptoms of ALS? So ALS symptoms can vary from where and how they begin, and one of the ways that we track this is through, which a lot of the clinics you will hear, they refer to it as an FRS, which is a ALS Functional Rating Scale Revised. And no two people with ALS are the same. This is an example of some of the things that we track with the functional rating score. So it measures 12 aspects of physical function, ranging from one's ability to swallow, climb steps, and breathe. Each function is scored from 4 being normal to 0 having no ability, with the maximum total score of 48. Again, no two people with ALS are identical, meaning every FRS score is completely personal and unique. So the National ALS Registry, this is something that a lot of our care service managers, we highly push and advertise for our patients to take part in this. And we do have a table, that's the CBC and the Learning Lab, so please take advantage of that. But the goal is really to estimate the number of new cases of ALS diagnosed each year, to estimate the number of people who have ALS and who gets ALS. And it really is just capturing the important risk factors for ALS patients. Like I always say, it's really helping out our scientists to see what is the common denominator between ALS with one patient to the next. Now, what a treatable disease, and I say this is where our care service managers really shine. We give you a lot of information and sometimes a lot of emails, so I'm apologizing in advance. But while there is currently no cure for ALS, there are treatments and interventions that extend and improve quality of life. And Kimberly, my counterpart, will definitely get into that a little bit further. Thank you.
Thank you, Charlene, and good morning, everyone. So our ALS clinics follow a disciplinary care model. These models bring together a team of specialized trained healthcare professionals who can address the many needs of people living with ALS, allowing them to receive care from each discipline during a single visit. The care team typically includes an ALS neurologist, an ALS associate chapter liaison, a social worker, speech-language pathologist, registered dietitian, occupational therapist, physical therapist, respiratory therapist, mental health professional, and a nursing professional. So as you can see here, our ALS clinics are located all over the nation, but momentarily we have more clinics towards the east coast of the nation. All right, so as many of you know, living with ALS also requires several lifestyle adjustments. In order to manage these changes effectively, it's important to prepare both yourself and your living environment. Ensuring your safety and maintaining your preferred way of life are crucial. This requires regularly assessing and adapting your physical surroundings and personal situation as the condition evolves. People living with ALS use various DME products throughout their condition, but fortunately, there are numerous adaptations, strategies, and equipment options available to help you stay safe and maintain mobility. To determine which equipment will best suit your needs, you can collaborate with your care services manager and clinic team. These discussions usually occur during your clinic visits. Thank you. So the following slides will include some images of assistive communication devices. If you have any questions regarding communication devices today, please visit Rachel Haynes. Rachel Haynes is an International Ballroom 1, and she is our Assistive Technology Program Specialist and is located in our Learning Lab today. Right, here we have some visuals of mobility gait support. More visuals and information of these types of devices can be found in our Learning Lab today as well from our DME partners. So our equipment loan program provides temporary equipment loans to Florida residents diagnosed with ALS who are uninsured, underinsured, or unable to utilize their insurance benefits. Please refer to the slides for a list of our DME and AAC providers, and please visit 4 of our partners companies, Reliable, Ability, Forbes, and Toby, in our Learning Lab today in International Ballroom 1. Thank you. Next, I will have my colleague Alicia expand on living with ALS. Thank you.
Good morning. Okay. Let's do this. Okay. A proactive approach is a way of thinking and acting that involves taking action before a problem arises. This can be done in several different ways depending on your journey, but overall planning, preparation, and communication are some of the main key elements needed throughout your ALS journey. And the ALS Association works to help you take that proactive approach. The ALS Association continues working to serve, advocate, empower individuals and their families who are affected by ALS. We provide an incredible amount of programs and services for this community. Some examples of the programs that we provide are financial assistance opportunities through grants that help with respite, home, vehicle modification, medical expenses, and clinical transportation. We help refer our patients to physicians and ALS clinics within their respective regions. Also, as mentioned by Kim in the previous slides, we offer our loaner communication devices and assistive technologies program and our equipment loan program. And overall, we provide nonstop information and support for caregivers and family members locally and nationally through our virtual resource support groups and advocacy programs. ALS often requires adjustments to your living situation. As your medical needs increase and your ability to perform everyday tasks decreases, you may need professional care on a daily or around-the-clock basis. This care may be provided in your own home, but also might require you moving to a different home or facility. And one example would be home care agencies. For most people, living at home is the preferred option, and most people living with ALS can live at home throughout most of their ALS journey as their disease progresses. It's typically the cheapest option and one that allows you to stay in a place that's similar and comfortable to you. A second option is assisted living facilities. They don't provide the level of assisted intensive skilled nursing and medical care offered by nursing homes, and therefore usually cost less than nursing homes. They also are typically more expensive than living at home. Assisted living facilities will not take a person living with ALS if they cannot ambulate. Unfortunately, the best location is typically at home for our ALS patients. Lastly, nursing homes. Of the different living arrangements available, nursing homes provide the most services and the highest level of medical care. A nursing home may be utilized by people living with ALS who are in advanced stages of their disease and need round-the-clock care. And there's also types of long-term care services. There are several different types providing long-term care throughout Florida for the most vulnerable citizens and it's a multi-agency effort, which includes services such as the Agency for Health Care Administration, which administers the statewide Medicare Managed Care Program, the Long-Term Care Program that creates a coverage policy and provides those eligible for services along in their long-term care plan that is personal to that individual. And then we have the Department of Children's and Families, which is responsible for determining financial eligibility for services. And we also have the Department of Elder Affairs, which is responsible for determining medical eligibility and level of care that's needed. Our ALS resource support groups. In the previous slide, we discussed some of our care services program, which one of them being our virtual ALS resource support groups. Each resource support group is categorized. We have our groups by regions, which are facilitated by the care services managers. We also have statewide support groups that discuss 4 different specific groups, and we have the nationwide support groups that are geared towards men and women who are caregivers. The Newly Diagnosed series, which is one of our statewide ALS resource support groups. This is a 7-part series that's facilitated by Charlene and Kimberly. This series includes multiple topics that discuss ALS progression, advanced directives, medical equipment, research, and so much more. When becoming newly diagnosed with ALS, there are tons of questions that are asked and tough conversations that need to be discussed. The Newly Diagnosed series will help in answering the big questions and figuring out what are your next steps. The series is every first and third Thursday of every month. We have multiple statewide virtual resource support groups, and another one that we have that's a multi-part series as well is called Our Living with, there we go, technical clicker difficulties. Okay, there we go, perfect. Our Living with ALS series, which is a 6-part series that Melissa and I facilitate every 4th Tuesday of each month. In the Living with ALS series, we have multiple different topics that go over family, caregivers, and the importance of continuing to live your life to the fullest. There is so much to learn and to consider, decisions to make, symptoms to manage, treatment options to evaluate, and adjustments to almost every detail of your daily routine. It's a great deal to take in, but we want to make sure that we're here for you throughout your ALS journey. We all have the flyers for all of our support groups at the care services table with more information on those. And if you're interested, you can speak to one of us or any of your care services managers in your prospective regions. And then moving forward, no matter if it's the initial diagnosis to the end of life, we hope that the information and resources we provide you here will help prepare you to take control of your ALS journey. And then I will have my colleague, Melissa, also may come up.
Thank you. So just to wrap things up just a bit, in Living with ALS, we do talk about taking control in your ALS journey. So this is very important, and there are plenty of ways to do so. Specifically, you can take a proactive approach by attending community support groups, utilizing our resource guides, and continuously participating in therapies and care. Now, the resources we provide do allow you to address various needs. For example, we offer books and booklets that can be found on our website and printed or mailed to your home. This includes resources for caregivers to discuss different topics related to their daily experiences and needs. Dun, dun, dun. Okay. There's now, of course, there's plenty to learn and consider in regard to ALS, especially as each journey is different. Always continue to educate yourself on any new ALS news and research. While educating yourself, we do offer the following information and tools, such as our Care Services webinar, archive, and our families and youth education books. So moreover, ALS truly is a family matter, and it is important to remember to care for our caregivers. So a little known fact is that almost half of our caregivers say they feel unprepared for changes in caregiving responsibilities, and many experience depression. So some of the tips and tricks that can be used to combat this are asking for help, educating yourself, being aware of depression, valuing yourself, managing your stress, knowing you are more than a caregiver, talking to other caregivers, such as in our caregiver support group, and utilizing assistance programs. And of course, staying connected and staying in touch is also a great way to support each individual impacted by ALS. Sorry, I'm going too fast. This can look like staying in touch, consistently showing up, and keeping all family members in mind, and overall joining the fight to end ALS. Now, our youth is also impacted by ALS, as we know, so we offer different support and resources. So there are several books made to address ALS, caregiving, family and friends, and the end of life presented in an educational way for our young ones. And additionally, there are other resources listed that we offer. It's all a matter of looking into what we provide. And of course, there are ways to live life to the fullest. So this can look like changing how you do things and adjusting your activities, specifically adapting to leisure activities such as outdoor recreation, indoor activities, and sports and physical recreation. And this can, of course, be done with assistive equipment. And of course, with living your life to the fullest, it is imperative to always check with a physician prior to any extended travel. So this can look like making sure you're prepped for airline travel and that it is fully accessible to your needs. So planning ahead with transportation resources and overall getting out there to enjoy the experiences that make you happy. Questions? Okay, we answered everything. No, I'm kidding. Any questions at all?
Not everybody at once.
Yeah, just too many hands. I can't see.
I know.